Not all gas is harmless. These 4 types reveal what's going wrong inside your gut, and one can signal real danger. Don't laugh it off. The last one is a red flag you can't ignore. This gut signals. Let's be honest, ladies, gas happens. It's a natural byproduct of digestion. Our amazing bodies break down food, and in that process, the trillions of bacteria living in our gut, our microbiome, go to work. Sometimes a little gas is just that, a little gas. It's part of the biological symphony playing inside you every single day. But here's the kicker, especially as we get a little older, that symphony can start to hit some sour notes, and those notes aren't just an annoyance, they're a message. Our digestive systems, like everything else, undergo changes with age. We might produce less stomach acid, our gut motility can slow down, and the composition of our gut bacteria can shift. These subtle, often unnoticed changes can profoundly impact how we digest food, and consequently, the kind of gas we produce. It's not just about what you eat anymore, it's about how your aging system processes it. Consider this. Have you ever found yourself in recent years reacting differently to foods you've eaten your whole life without issue? Maybe that comforting bowl of ice cream now sends you rushing for the bathroom, or a simple slice of pizza leaves you feeling like you've swallowed a balloon. This isn't just getting older. It's your body's way of telling you that the internal landscape has changed. And when it comes to flatulence, these changes can manifest in distinct ways that are worth paying attention to. We're often taught to just deal with it, or worse, to feel shame. But imagine for a moment if we reframe this. What if instead of shame, we felt curiosity? What if we saw these digestive whispers as invaluable information, empowering us to take control of our health rather than just enduring whatever our bodies throw at us? This isn't about being overly analytical or hypervigilant. It's about developing a keen, intuitive understanding of your own unique biology. It's about listening to the wisdom your body already possesses and simply needs you to acknowledge. This is foul odor. Now, let's talk about the first type of gas that should make you pause and pay attention, the extremely foul, often described as sulfurous or rotten egg smelling, flatulence. We're not talking about your run-of-the-mill, slightly stinky gas after a big meal of broccoli. We're talking about something that clears a room, that makes you wonder if something has truly gone awry inside. This isn't just an unpleasant surprise. It's often a sign that specific bacteria in your gut are having a party they shouldn't be having, or that your digestive system is struggling to break down certain compounds. The main culprit behind that distinctive rotten egg smell is hydrogen sulfide, a gas produced by bacteria when they ferment undigested food in your colon. While some production is normal, an excessive amount points to an imbalance. Think about it. Your gut is a complex ecosystem. When that ecosystem is out of whack, the bad actors can start to thrive, producing gases that are not only offensive, but also indicative of deeper issues. For senior women, this can sometimes point to conditions like small intestinal bacterial overgrowth or SIBO. In SIBO, bacteria that normally reside in the large intestine migrate into the small intestine where they shouldn't be. These misplaced bacteria then ferment food particles much earlier in the digestive process, leading to excessive gas, bloating, and often that particularly noxious odor. Another common cause, malabsorption. As we age, our bodies can sometimes become less efficient at absorbing nutrients, especially fats. When undigested fats reach the large intestine, bacteria go to town on them, producing a very potent, often rancid-smelling gas. Consider a scenario. You've always loved your protein, perhaps a nice steak or some chicken. But suddenly, after these meals, the odor of your flatulence becomes unbearable, accompanied by a feeling of heaviness. This could be your body signaling that you're not producing enough stomach acid or digestive enzymes to properly break down proteins, or that your gut microbiome isn't equipped to handle the byproducts. It could also be a reaction to specific sulfur-rich foods like cabbage, broccoli, garlic, or eggs, if consumed in excess or if your gut sensitivity has increased. The key here isn't to panic, but to observe. Is this a one-off or a recurring pattern? Is it consistently associated with specific foods or times of day? If you notice this pattern, it's a good time to start a simple food and symptom diary. Jot down what you eat and then note the characteristics of your gas, any bloating or other digestive symptoms. This isn't about becoming obsessive, it's about gathering data points that empower you and your doctor to connect the dots. Don't dismiss it as just being gassy. Recognize it as a potential call for help from your internal systems. Now that's constant bloating. Next up, let's address the persistent, excessive gas that's almost always accompanied by significant bloating. This isn't just a little rumble after dinner. This is the kind of distension that makes you feel like you're several months pregnant, regardless of what you've eaten. It's the kind of bloat that makes your clothes feel tight, causes discomfort or even pain, and leaves you feeling sluggish and self-conscious. While some daily gas is normal, we all pass gas anywhere from 10 to 20 times a day. When it becomes constant, overwhelming, and makes you look and feel visibly swollen, it's time to listen closely. This pattern often points to an intolerance, a sensitivity, or even a chronic digestive condition that warrants investigation. One of the most common culprits for this in senior women is lactose intolerance, which surprisingly can develop or worsen with age. Our bodies produce an enzyme called lactase, which breaks down the lactose in dairy products. As we get older, many of us produce less lactase, meaning that comforting glass of milk, yogurt, or cheese can become a source of profound digestive distress. The undigested lactose travels to the colon, where bacteria feast on it, producing copious amounts of gas and leading to that characteristic painful bloating. It's a silent, often overlooked change that can significantly impact daily comfort. But it's not just dairy. Other common culprits in this category include sensitivity to FODMAPs, a group of fermentable carbohydrates found in a wide range of healthy foods like certain fruits, vegetables, legumes, and sweeteners. For some, these otherwise nutritious foods can be highly problematic, leading to excessive gas and bloating. Beyond intolerances, this persistent bloating and gas can also be a hallmark symptom of irritable bowel syndrome, or IBS. IBS is a functional gastrointestinal disorder that affects the large intestine. Its symptoms often include cramping, abdominal pain, bloating, gas, and changes in bowel habits, diarrhea, constipation, or both. While IBS can start at any age, it's not uncommon for symptoms to become more pronounced or to develop later in life, sometimes triggered by stress, dietary changes, or even previous gut infections. It's not just about discomfort. Chronic inflammation or distress in the gut can have far-reaching effects on your energy levels, mood, and overall quality of life. Imagine feeling constantly full, tight, and uncomfortable. It wears on you. The good news is that if this sounds like you, there are highly effective strategies to manage these conditions. This might involve an elimination diet under guidance, targeted probiotics, or specific dietary adjustments. The key is recognizing the pattern and understanding that it's not just gas. It's a message from your body that needs attention. Don't dismiss it as an inevitable part of aging. It's a symptom that can often be significantly alleviated or even resolved with the right approach. Bostock's painful episodes. Now we move into a territory that demands even more serious attention. Gas that is consistently accompanied by significant abdominal pain, sharp cramping, or even a feeling of intense pressure. This isn't the fleeting discomfort that comes with typical gas. This is pain that makes you double over, interrupts your daily activities, and leaves you truly distressed. When gas becomes a vehicle for genuine pain, especially when it's recurrent, it's a red flag your body is waving, indicating something more serious than a simple digestive hiccup. This is where we need to shift from observation to action, because ignoring this could mean overlooking conditions that require medical intervention. For senior women, one of the primary concerns when gas is accompanied by pain is diverticulitis. Diverticula are small, bulging pouches that can form in the lining of your digestive system, most commonly in the large intestine. While diverticulosis, having the pouches, is common and often asymptomatic, diverticulitis occurs when these pouches become inflamed or infected. Symptoms often include persistent abdominal pain, usually in the lower left side, along with nausea, fever, and a marked change in bowel habits, which can include both constipation and diarrhea. The trapped gas and inflammation within these pouches can cause excruciating pain, and it's a condition that absolutely requires prompt medical attention. Left untreated, diverticulitis can lead to serious complications like abscesses, perforations, or blockages in the bowel. Another serious possibility, particularly if the pain is severe and accompanied by changes in bowel habits like persistent diarrhea or constipation, weight loss, or blood in the stool, could be inflammatory bowel disease, IBD, such as Crohn's disease or ulcerative colitis. While often diagnosed in younger individuals, new diagnoses or flare-ups can occur later in life. These are chronic inflammatory conditions of the digestive tract that can cause significant damage over time. And though it's uncomfortable to even think about, persistent, unexplained abdominal pain, gas and bloating in older women should always prompt a discussion with your doctor about screening for gastrointestinal cancers, particularly colorectal cancer or ovarian cancer, as these can sometimes present with vague digestive symptoms. I'm not saying this to alarm you, but to empower you with knowledge. It's crucial to understand that while gas and pain can be benign, they can also be the earliest whispers of something that needs a louder voice from a medical professional. If you are experiencing recurrent or severe abdominal pain with gas, do not hesitate. Call your doctor. Describe your symptoms clearly, including their frequency, intensity, and any other accompanying changes. This isn't a sign of weakness, it's a demonstration of self-care and wisdom. Loss control. This brings us to the fourth and perhaps most distressing type of gas older women should worry about: involuntary flatulence, or more broadly, a noticeable loss of control over bowel functions. This isn't just about an unexpected leak or a poorly timed expulsion. It's about a feeling that your body is no longer reliably doing what you expect it to do. For many women, especially as they age, this can manifest as a struggle to hold gas in, or worse, accidental leakage of stool along with gas. This is often accompanied by profound embarrassment, social withdrawal, and a significant reduction in quality of life. Yet, it's a topic steeped in shame, often suffered in silence, even though it's surprisingly common and, crucially, often treatable. The primary culprit behind a loss of control, both for gas and for stool, is often related to pelvic floor dysfunction. Your pelvic floor muscles form a sling at the base of your pelvis, supporting your organs and playing a critical role in continence. Over a lifetime, factors like childbirth, chronic straining from constipation, weight gain, hormonal changes during menopause, and simply the aging process can weaken these muscles or damage the nerves that control them. When these muscles lose their strength or coordination, it becomes harder to effectively clinch and hold back gas or stool until a convenient time. You might feel the urge, but the muscle just doesn't respond quickly enough or strongly enough. This isn't a moral failing, it's a physical issue, a weakening of a crucial muscular system. Beyond pelvic floor issues, nerve damage can also play a role. Conditions like diabetes, stroke, or other neurological disorders can sometimes affect the nerves that control the anal sphincter and the rectum, leading to impaired sensation or reduced muscle function. Certain medications can also contribute to changes in bowel control. Think about how many women quietly adjust their lives around this problem, avoiding social gatherings, limiting activities, always scoping out the nearest bathroom, constantly worrying about an accident. The emotional toll is immense. But here's the powerful, hopeful message: you do not have to live this way. Pelvic floor physical therapy, for instance, is incredibly effective at strengthening and retraining these muscles. It's not just about Kegels, it's about a comprehensive approach to muscle awareness, strength, and coordination. Don't let shame be a barrier to seeking help for this. Your quality of life is too important. If you find yourself struggling with a loss of control, whether it's gas or stool, it is absolutely paramount to speak with your doctor. This is not a trivial complaint. It's a significant health concern that has well-established effective treatments, and the first step is simply having the courage to speak up. You deserve to live with confidence and comfort. Better holistic health. So, we've talked about the 4 types of farts that warrant your attention. But understanding the problem is only half the battle. The real power comes from taking action. This isn't just about identifying a symptom, it's about embracing a holistic approach to your gut health and overall well-being. Think of it as creating a resilient, harmonious internal environment where problematic gas is the exception, not the rule. And this involves more than just avoiding certain foods. It's about lifestyle awareness and proactive self-care. First, let's talk about dietary detective work. As we discussed, food intolerances and sensitivities are incredibly common, and they can shift with age. The single most powerful tool you have for identifying your specific triggers is a meticulous food and symptom diary. For a few weeks, write down everything you eat and drink, alongside any digestive symptoms you experience, not just gas, but also bloating, pain, changes in bowel movements, and even your energy levels. Be specific with quantities and ingredients. You might start to notice patterns. Every time I have wheat, the sulfur smell returns, or dairy consistently causes severe bloating. This isn't about deprivation, it's about personalized understanding. Once you identify potential culprits, try a guided elimination of those foods for a short period, under professional guidance if possible, and then slowly reintroduce them to confirm the sensitivity. You're not just guessing, you're gathering evidence from your own body. Next, consider hydration and mindful eating. So many of us rush through meals, gulping down food and air, which is a recipe for gas and discomfort. Slow down, chew your food thoroughly. Aim for 20-30 chews per mouthful. This gives your digestive enzymes a head start. Drink plenty of water throughout the day, but avoid chugging large amounts during meals, as this can dilute digestive juices. Instead, sip water between meals. Proper hydration is fundamental for smooth digestion and preventing constipation, which can exacerbate gas issues. Think of it, your digestive tract needs lubrication, and water is the ultimate internal lubricant. Then there's the often overlooked aspect of stress management. Our gut and brain are intimately connected through the gut-brain axis. When we're stressed, our digestive system can go haywire. Stress can alter gut motility, change the composition of our gut microbiome, and even increase our sensitivity to pain. Practices like deep breathing, meditation, gentle yoga, spending time in nature, or simply dedicating time to hobbies you love can have a profound positive impact on your gut health. It's not just in your head, the physical. Manifestations of stress on your digestion are very real. Making stress reduction a non-negotiable part of your daily routine is as important as what you eat. Finally, and perhaps most critically for senior women, movement and pelvic floor health are non-negotiable. Regular physical activity helps stimulate gut motility and can reduce gas and bloating. Even a brisk walk for 30 minutes a day can make a significant difference. And for pelvic floor issues, whether it's involuntary gas or more serious concerns, seeking out a qualified pelvic floor physical therapist is a game changer. These specialists can assess your individual needs and provide targeted exercises and strategies to strengthen these crucial muscles, often restoring a sense of control and confidence that you might have thought was lost forever. Don't let embarrassment prevent you from accessing this invaluable support. These habits aren't isolated. They work in synergy. Imagine reducing stress, which calms your gut. Then you eat mindfully, giving your digestive system an easier job. You hydrate, keeping things flowing smoothly. You exercise, encouraging motility. And if needed, you address specific muscle weaknesses with targeted therapy. This isn't about quick fixes. It's about building a foundation of wellness that empowers your body to function optimally and communicate its needs clearly, without alarm bells. Your body is constantly talking to you. It's time we learned to truly listen. In closing, remember this. Your body is an incredible complex machine, and it's constantly sending you signals. Gas, especially for senior women, is not always just gas. It can be a powerful messenger, a subtle whisper that tells you when something needs a little more attention. By understanding the 4 types of flatulence we've discussed, the foul smelling, the constantly bloating, the painfully episodic, and the uncontrollable, you're no longer passively enduring. You're actively engaging with your health. You are empowered to be your own best advocate, to observe, to question, and to seek the right support when needed. Don't let embarrassment or societal silence prevent you from listening to these crucial messages. Your comfort, your dignity, and your long-term health depend on it. Listen to your body, trust your instincts, and never shy away from talking about what truly matters for your well-being. Which habit are you going to start first to protect your gut health and better understand your body's signals? Drop your choice below. Let's inspire each other.